Hello everyone, my name is Bartkowiak. I am a Doctor of Chiropractic and Clinical Director at Health HQ here in sunny Southsea. And today we're going to be discussing some details on how and when to use hot and cold when you're getting pain. So there is a lot of debate and controversy on this topic. I am going to give you my advice and the logic and justification behind my view so that you're able to make the best, most informed decision for you. Now, we can see people who have been in a lot of pain and sometimes for very long periods of time. Now, constant pain is awful and can make people do anything just to get some relief. So many people come in saying that they've tried everything, but can get some comfort from heat. Hot baths, hot water bottles, creams, tiger balm, electric blankets, they can all be a great source of comfort. And I get it. They're right, heat feels lovely. But even though it feels nice, it could be making the inflammation that's there worse. Now, if you're used to doing some kind of team sport or group exercise, you may remember that the first thing you want to do if you sprain or strain or pull something is RICE. Rest, ice, compression, and elevation. First steps pretty much every time. Another example, if you step off a curb wrong and twist your ankle and it blows up like a balloon, which are you going to put on it? Heat or ice? Ice. Why? What does the ice do? It brings the inflammation down. Now, what do you think could happen to the amount of inflammation that's there if you put heat on it? It could increase. Now, as a very important side note, inflammation has a bad rep. Inflammation is crazy important and forms some of the fundamental parts of the healing cascade. Without it, healing and repair wouldn't happen properly. When you have a lot of inflammation causing pain in one part of your body, taking painkillers, anti-inflammatories, strongly decreases that inflammation and reduces pain. It will also decrease all the other tiny little pockets of inflammation throughout the rest of the body that occur as a normal response, not to damage as such, but to the low level wear and tear of day-to-day use. Wear and tear that needs repair. Now, obviously, we don't want areas with lots of inflammation, but we don't want to wipe it all out completely either. Like we said, inflammation plays a part in the processes that defend and repair the whole body. We're not aiming for zero inflammation, we're aiming for appropriate inflammation levels. Now, painkillers, anti-inflammatories, can be very helpful and appropriate to quickly reduce high levels of inflammation and reduce symptoms when used correctly in the short term. But long-term use can have side effects, and so, at least in my opinion, in the majority of cases, using them should be a stepping stone to a more appropriate long-term treatment strategy. So, heat. Heat feels great short term, but can increase inflammation levels for longer and generally make the pain and problem last longer than it really needs to. Ice can help to reduce those inflammation levels locally in the area where it's needed the most without the possible side effects of some medications or affecting the useful little pockets of inflammation in other parts of your body. So my advice, I know that heat feels nice, but when you have pain, the first thing you want to do is to stick with a tried and true rest, ice, compression, and elevation. Now, when using an ice pack, you ideally want to use something that is malleable and that will mold to the shape of the area that you're using it on. That's why we tend to reach for things like packets of frozen peas, but a proper gel-filled ice pack does work a lot better. I have had one patient try to use a packet of frozen potato faces. Apparently, they don't work all that well. Now, whatever you use, make sure you don't put the ice pack on bare skin. Make sure you wrap the ice pack up in a tea towel, pillowcase, or t-shirt, something before putting it on the painful area, or you could freeze the skin and make things worse. The main rule for using an ice pack is little and often, and how long you put the ice pack on for at a time depends on the depth of the area. For more shallow or sensitive areas like the neck, knees, elbows or ankles, about 5 minutes on, 25 minutes back in the freezer, and then repeat 3 to 4 times a day. It's even more effective if you do it later in the day, in the evening, when you've finished stirring it up during the day. Slightly deeper or less sensitive areas like the shoulders or outer part of your hips, 10 minutes on, 20 minutes back in the freezer. Deep areas like your low back or your pelvis partly depend on your build. If you are small and slight and petite, then 15 minutes on, 45 minutes back in the freezer. Big rugby players or anyone still clinging on to their winter coat can keep it on for a little bit longer, so 20 minutes on, 40 minutes back in the freezer. These times are guides, and I recommend them as maximum times, no longer. It is very possible to over ice an area and make things worse. If it gets too cold, take it off. If you get to the maximum time and don't think it's got cold enough, take it off anyway. Remember that cooling the area down will also numb it slightly, skewing your perception of how cold it actually is. So to check, place your hand over the area to feel how cold it's become. That way you will get a much more accurate idea. An important thing to remember also is that using an ice pack isn't like using heat or painkillers, which can actually make the area feel better pretty quickly. Unfortunately, using an ice pack is a lot more like taking a course of antibiotics. Take one, it's not going to make a blind bit of difference, but run the course and it can make a profound difference. And just like antibiotics, don't stop once the symptoms have gone. Run the full course or it could come back. Now, I don't want to completely demonize heat. Heat can be useful. If you wake up and it's stiff or achy, but you generally haven't been in pain, then heat can be a very useful tool to help get blood flowing and loosen things up, just not when there's a ton of inflammation there. So my recommendation would be heat really for morning stiffness only, not after being up for more than a few hours, and icing at the end of the day can help reduce the inflammation that is built up from you being active and using your body during the day, and may help to stop things stiffening up so much overnight from when you're asleep and not moving so much. And that's it. I hope you found this useful and learned a little something from it too. Like always, this advice is general and more to act as a reminder. For more specific advice tailored to your current condition, just ask your chiropractor. If you have any other questions, then please get in contact and we will do everything we can to help give you the help that you need. In the meantime, be cool and stick with your ice pack. Stay well, stay safe, stay mobile, and I'll see you soon. Take care. Bye-bye.